Hello guys, welcome to my new video in which I'm going to talk about another rare skin disease which can affect a person's whole life. Scleroderma, also known as systemic sclerosis, is a group of rare diseases that involve the hardening and tightening of the skin. It may also cause problems in the blood vessels, internal organs, and digestive tract. Healthcare providers classify scleroderma into two main types: localized scleroderma and systemic sclerosis. Localized scleroderma, also known as morphia, affects only the skin. While there is no cure for scleroderma, treatments can ease symptoms, slow progression, and improve quality of life. Scleroderma's signs and symptoms vary from person to person depending on which parts of the body are affected. Skin-related signs and symptoms. Nearly everyone who has scleroderma experiences a hardening and tightening of the skin. The first parts of the body to be affected are usually the fingers, hands, feet, and face. In some people, the skin thickening can also involve the forearms, upper arms, chest, abdomen, lower legs, and thighs. Early symptoms may include swelling and itchiness. Affected skin can become lighter or darker in color and may look shiny because of the tightness. Some people also experience small red spots called telangiectasia on their hands and face. Calcium deposits can form under the skin, particularly at the fingertips, causing bumps that can be seen on X-rays. Raynaud's phenomenon is common in scleroderma and occurs because of an inappropriate and exaggerated contraction of the small blood vessel in the fingers and toes in response to the cold or emotional distress. When this happens, the digits may turn white, blue, or red and feel painful or numb. Raynaud's phenomenon also can occur in people who don't have scleroderma. Digestive problems. Scleroderma can affect any part of the digestive system from the esophagus to the rectum. Depending on which parts of the digestive system are affected, signs and symptoms may include heartburn, difficulty swallowing, bloating, diarrhea, constipation, and fecal incontinence. Heart and lung problems. When scleroderma affects the heart or lungs, it can cause shortness of breath, decreased exercise tolerance, and dizziness. Scleroderma can cause scarring in the lung tissues that may result in increasing shortness of breath over time. There are medications that may help slow the progression of this lung damage. Scleroderma can also cause the blood pressure to increase in the circulation that goes between the heart and the lungs. This is called pulmonary hypertension. In addition to shortness of breath, pulmonary hypertension can also cause excess fluid in the legs, feet, and sometimes around the heart. When scleroderma affects the heart, heartbeats can become irregular. Heart failure may also occur in some people. Scleroderma results from an overproduction and accumulation of collagen in body tissues. Collagen is a fibrous type of protein that makes up your body's connective tissues, including your skin. Doctors don't know exactly what causes this process to begin, but the body's immune system appears to play a role. Autoimmune disorders happen when your immune system accidentally attacks your body instead of protecting it. Experts don't know why your immune system turns on you. It's like it can no longer tell the difference between what's healthy and what's not, between what's you and what's an invader like bacteria or a virus. If you have scleroderma, your immune system triggers your body's cells to produce too much collagen, a protein. Your body needs collagen to have a strong, healthy connective tissue to support your organs and hold parts of your body in place. But when you produce too much of it, your skin and other tissues can be thicker and more fibrous than they should be. Scleroderma is a chronic condition, which means you'll need to manage your symptoms for a long time, maybe the rest of your life. It can also cause life-threatening complications if it affects tissues in your organs. Localized scleroderma only affects one part of your body, and in systemic sclerosis, other organs in addition to your skin are also affected. It can affect parts of your respiratory system or even your digestive system. Scleroderma is rare. Experts estimate that all types of scleroderma affect around 250 out of every 1 million people in the US. Some people with early scleroderma don't have any symptoms. The most common scleroderma symptom is having patches or streaks of thickened, waxy skin. Other common symptoms include joint pain, stiffness, especially when waking up in the morning, fatigue, means feeling extremely tired all the time, and unexplained weight loss. Experts don't know for sure what causes scleroderma. Some studies have found that it can run in families, meaning biological parents can pass it on to their children, but this is rare enough that there is no definite proof it's a genetic disorder. How is scleroderma diagnosed? A healthcare provider will diagnose scleroderma with a physical exam and some tests. You might need to visit a rheumatologist, a healthcare provider who specializes in treating autoimmune disorders. They'll examine your body and ask you about your symptoms. Tell your provider which symptoms you're experiencing, when you first notice them, and if anything seems to make them worse. You'll also need a few tests to rule out other conditions that cause similar symptoms. Blood tests, pulmonary function tests, biopsy, and endoscopy are some different tests that healthcare providers use to diagnose scleroderma. How is it treated? There is no cure for scleroderma, but your healthcare provider will help you find a combination of treatments that manages your symptoms and minimizes how much they impact your daily routine. Which treatments you'll need depends on where you're experiencing symptoms and how severe they are. Some common scleroderma treatments include skin treatments, immunosuppressants, medicines to manage specific symptoms, physical therapy, light therapy or phototherapy, and stem cell transplants. Any chronic condition is serious, including scleroderma. That's because you'll probably have to manage symptoms for the rest of your life. However, that doesn't mean scleroderma will control your life. No two people's experiences are the same. Share your concerns or worries with your healthcare provider. Living with a chronic condition can be exhausting. Take time to give yourself credit and recognition for all the hard work it takes to manage your symptoms. Thank you guys for watching my video. I hope you have enjoyed it.